Hello to everyone. I am Dr. Margaret Rutherford. I'm a clinical psychologist. I'm from the United States. You might be able to tell from my voice that I'm from the South. I actually live in Arkansas, in the northwest part of Arkansas, in a little town named Fayetteville. And I've been a clinical psychologist for in let's see. Well, it's 30 years this year. I can't believe that. It is 30 years this year since I was honored to get my degree and to begin to be seeing people as a psychologist. I got my training, just so you would know, at University of Texas Southwestern Medical School. They had a psychology department in their division of psychiatry. So I trained alongside psychiatric residents, and it was a very thorough and wonderful training. But I had no idea that I would ever write a book or become so passionate about a particular message. I do love doing therapy because I got good therapy myself and I switched my whole life around. I was a professional singer and a musician, and in 9 years I became a clinical psychologist. So you can do that too if you ever want to change your career. I first became a part of the Minds Journal, years ago, when they contacted me and asked my permission to use some of my writings. My website's drmargaretrutherford.com, and I was always very appreciative. One, they asked, and not everyone does ask. And secondly, they've just been a really regular participant and certainly supporter of my work, because I started blogging in 2012, and then I began podcasting in 2016. So they've really more been very much a part of my blogging life and everything that I've written about. And so when they came to me and said, "Would you like to do a Facebook Live?" I said, "Yes, of course." And we've already getting some comments. That's just wonderful. Hold on. Um, let's see. I don't know if I can scroll. Um, hmm. Okay, so determination is everything. My husband left my heart broken for more than I can see. Okay. Um, I appreciate, Dennis or Denise, your good work with this man or woman. But right now we're going to be talking about perfectly hidden depression, and I'd love to keep the questions on that topic. So, what is perfectly hidden depression? First, let me tell you the story of the book. I My son had left for college in 2014, and by that time I had been writing blog posts for a couple of years, and I was just sitting in my house thinking, what could I write about this week? And all of a sudden I thought about these people that I had seen through the years, who, when they first walked in my door, would not be someone that would tell me, "Oh, yeah, I'm here because I'm depressed." In fact, quite the opposite. Instead, they would say, "Oh, I've got some anxiety," or, "For some reason, I'm not sleeping well," or "I'm struggling with an eating disorder. I just can't make myself eat," or "I'm eating all the time," or something like that. So, really, what bonded these people together was when I really sat down and thought, "Okay, I'm going to put their names down on a piece of paper, and I'm going to see what actually is the thread that these people share, or the facet of their personality or their functioning that they share." And what it was that they did not know how to talk about their painful emotions. In fact, they would deny that they had a lot of emotional pain, even if they were describing something to me that for everyone would be even traumatic, not just serious, not just painful, but traumatic. And so as I was sitting there in April of 2014, I started writing about these people, and I just pulled a term out of the air, and that term was perfectly hidden depression. The title of the blog post was "The Perfectly Hidden Depressed Person, Are You One?" Well, the post went viral, and I'd never had a post go viral before. The next day, I was writing for the HuffPost, the Huffington Post at the time, and they published it as well. And I got hundreds of emails from people. How do you know about this? It's like you're in my head. What I had described were people who on the outside looked very happy, very successful, very driven. Often people would come up to them and say, I don't know how you get everything done you do. I wish I were more like you. Your family is perfect. And yet they had a substantial amount of pain that they were trying really to avoid or deny. They weren't trying to deal with it or cope with it. They were trying to push it away as best they could. Sometimes even to the point where they had grown unaware that that's what they were doing. In fact, often to the point that they had, this had become such an automatic um, habit, an automatic mind habit that they had done since childhood that they didn't know what was going on. So I got really fascinated. What was out there on perfectionism? Well, I found Dr. Brené Brown's work. She had written The Gift of Imperfection by then, and that's a wonderful book if you don't know it. I found a book named by Terrence Real, who who wrote the book, I Don't Want to Talk About It. And it's about covert depression in men. He thought that depression in men and women were different. Thank you, Kurt. I'm delighted to be. I hear expert minds and I kind of, I'm not sure about that. But I think I'm so passionate about this message. I'm willing to tread into those slightly narcissistic waters and talk about perfectly hidden depression. So I found their books, but I found a lot of workbooks on perfectionism. In fact, some very good and very popular workbooks. Stephen Guys has one of them, How to Become an Imperfect Perfectionist or something like that. And it's still doing very well today. So I found workbooks on perfectionism, and there are many of them out on the market now. What no one was really addressing that I could find, even Dr. Brown, was the danger of this and because of the why of it. The danger was because it was based in shame, and it was based in, now I know it's based in trauma that has been, you've distanced yourself from it. You have stowed it away, as I was saying a few minutes ago, and we're going to talk about that very process here in a second. And that makes it, in fact, when you think about some of the recent suicides, of people that are well known, it's very frightening to think that, and I bet every one of you listening to this, every one of you knows someone who has died by their own hand, died by suicide, and no one suspected it. I know personally 3 or 4 people maybe, and not just because I'm a therapist. Certainly there have been, again, celebrities who have done so. Most recently, Chesley Christ, who was the Miss USA, the oldest Miss USA. She was 28 when she won it, and she died violently. She meant to kill herself. There was no doubt about that. And I'm going to talk to y'all about her in a little bit. I'm going to quote her. We had another here in the United States, and I'm sure y'all are going to be listening to me from all over the world. Here in the United States, again, there was a young soccer player who went to Stanford whose name was Katie Meyer, and she was 22 and full of life and didn't seem to have a one thing to be unhappy or certainly suicidal about, and she died also violently. So that's the story of the book. Now, when I went to the academic literature, it was ripe with warnings about perfectionism and how it's something that has been grossly understudied as far as its relationship with trauma or depression. I'm sorry. Now, what has been studied a lot are these different categories of perfectionism. Let's talk about that for a second, because, when I first started writing about this, which I did for at least a year, 3 years before I ever got a book publisher, people would comment to me and say, you're trying to pathologize what is really something that is a strength. It's a character trait, which is a strength, which is to pull yourself up by your bootstraps and have courage and just don't whine and get on with life when bad things happen to you. I agree. I mean, I think that resilience, that kind of courage and resilience is to be greatly not rewarded, to be admired. Nelson Mandela himself, and I'm going to not quote him directly, said, if you're going to admire me, don't admire me for my accomplishments, admire me for the many times I've fallen down and gotten back up, or been pushed down, I might add. So, he wanted to say it's the getting back up. It's the uh, reapproaching life. It's about not letting the bad things, even the traumatic things that happen to you, define you. I'm all about that. What I also, however, believe strongly in fact, I'm passionate about, is that we must be able, as human beings, to to deal with all of our emotions, to deal with the ones that are harder to work through, like anger and fear and grief and sadness and disappointment and all those kinds of things. Um, the biases that we live with and the discrimination that's out there, as well as we want to be able to work through the joyful things and the things that bring us contentment and the things. I mean, obviously, those are easy to feel. That's happy. That's really good. And so, well, maybe not for everybody, but anyway, it's those are much more pleasant, right? So, but I believe you have to be able to do both to know that you have the skills to handle life. So let's talk a little bit about, is perfectionism ever constructive? Yes, it is. Of course, it is. The difference between constructive and destructive perfectionism, however, constructive perfectionism, I mean, I'd probably throw myself in that category. I really try to do my best. I'm just innately driven that way. And I think that I do it because, and people like me do it because of passion, because of creativity, because of something very innate within them that says, I really want to do well, but you can also learn from your mistakes. You can admit mistakes. It's a very process oriented kind of way of approaching life and doing things well. It's the difference between going on a trail that you've never gone on, hiking on a trail, and you can't wait to get to the destination. It's, I'm going to tell people I walked 5 miles, or I walked 10 miles, or I walked 1 mile. And that's the reason why I'm doing this, to succeed, to achieve, rather than I'm going to enjoy this hike. I'm not real sure how far I'm going. I would like to complete the hike, but I've got to learn along the way. So, constructive perfectionism is very, very process oriented, and you can take one thing off your plate when something else comes. You can manage and you can say no, and you have balance and fulfillment in your life. Destructive perfectionism, on the other hand, is usually governed by inner voices of shame and self criticism, even self loathing. That is about, you've got to prove to the world that you're not what this voice is inside of you saying. Okay? It is based on achievement. The achievement is the thing, and you actually need to achieve it without even looking like, it's hard for you. You want other people, these are called perfectionistic concerns. You want other people to see you as cool as a cucumber, as you've got this handled, that you know what you're doing, and that you go, just your life becomes fulfilling one expectation after another expectation after another expectation. Gordon Flett, who is a premier researcher in perfectionism, says it's like, the better you do, the better you feel you must do, and the better that's expected for you to do. It's like being on a treadmill, that except you're not in control of the incline nor the speed. And so you can imagine the pressure of that life, the absolute pressure. You don't take anything off your plate. You don't make room for self-care. Self-care. What is that? And you're not fulfilled by the process. Maybe briefly, I reached this goal and I did it in X amount of time and I made this amount of money doing it. And I'm getting promoted because of it, or I've gotten a community award for doing it. All of that's wonderful, but I'm pressed to do the next thing. I had a woman one time who came to me. She said, "I'm not a human, I'm a doman. I've got to get up and do every day. My very existence isn't enough to make me valuable." Right? Can you hear the pain in that? I'm sure you can. I said a few minutes ago that I've also come to the conclusion that perfectly hidden depression could also be named trauma-based perfectionism. And what I mean by that is that it is born. I knew that it was born in very diverse ways. You could have been subjected to parental abuse or neglect, and so as a camouflage, important word, and as a camouflage that you didn't want anyone to see, or certainly you were told you must never tell anyone, or it was just a rule in your family that we don't talk about anything bad happening in this family. The fact that your mother, your father's a roaring alcoholic, that's a secret. The fact that there's violence at home is a secret. The fact that, or somewhat on the complete opposite spectrum, of part of the spectrum, is people that become highly accomplished, and that's what they're known for. That's what their parents jump in and say, what's next? What's next? We got to, we're all about achievement in this family. Or perhaps you were pulled into a parental dynamic, which is called enmeshment, where it became your job to make that parent happy, and your success is what did that, but you could never become your own individual. So you're stuck in this pattern of needing to please, and that just translates out into the world. It could be because you're a certain gender, and that gender in your culture says, no, you don't feel anything. You're not allowed to feel. You have to be stoic. Um, it could be, again, something in your family. There are many pathways to perfectly hidden depression, but what they have in common is that there is this process through which probably starts out as what we psychologists would call suppression, meaning that you are very consciously not thinking about something that's going on. You say, okay, I got hit this morning, or my dog died this morning, and I've got to do this presentation. And so I'm going to stow that away, right? I'm going to compartmentalize, that is the word for it. I'm going to put it in a box, and then I'm going to put that box away in my mind. And then I'm going to get it back out when I have the opportunity and the time, and it's the appropriate place for me to feel those feelings. People with perfectly hidden depression or trauma-based perfectionism don't ever get it back out. They put it away. They consciously suppress it. Their minds do that. And then maybe your mind does that. And then you don't get it back out. Okay. What that can turn into very easily is what's called, again, repression, which is an unconscious, unaware. You become unaware of what you're doing. Think about when you learned to drive a car. You had to think about everything you did when you got behind that steering wheel, right? So, and especially with usually a parent or an older sibling or something yelling at you in the next seat. Um, so you had to very consciously do those things. Well, now, and then you suppress them, and then you repress them. I don't think about where I'm in front of, or whether my foot's touching me. It just does it. It just does it on its own. I'm not aware of it until I see something in traffic that gets my attention, like, oh, maybe I ought to pay attention to what I'm doing. We don't do that typically. We're thinking about something else, right? It has become something that we're not aware that we're doing it. Our minds take over. Well, what happens with imperfectly hidden depression or trauma-based perfectionism is that process begins to happen with pain, with emotional pain. It just happens, and you don't feel it anymore, and you put it away. It happens, you put it away. It happens, and as the more those habits are becoming ingrained in your mind, what we now know is that there are even neural pathways that are formed that become these little ditches that your mind just always goes there, always goes there. and they become part of who you are. So, okay, I'm going to wait to talk about that. So let's go on first or next to um, actually the traits themselves. I do before I get there. Well, I said I was going to quote Chesley Christ. She wrote an article in Allure magazine in January of 20, or came out in January of 22, and she killed herself maybe a month after that. Not too long. She says, this is when she was Miss USA. Why work so hard to capture the dreams I've been taught by society to want when I continue to only find emptiness? Too often I notice that the only people impressed by an accomplishment were those who wanted it for themselves. Meanwhile, I was rewarded with a lonely craving for the next award. Some would see this hunger and label it competitiveness. Other might call it the unquenchable thirst of insecurity. Bingo. Chesley Christ was more aware than not, perhaps, of what she was doing, but she didn't know how to undo it. Okay. And that's what made her so sad. One of the things, obviously. All right. So, what I did with this, I want to point out that perfectly hidden depression is not a diagnosis. I'm not quite narcissistic to believe that I think I've come up with a whole new diagnosis for my field of psychiatry and psychology. What I tried to do was actually pull together 10 traits of a syndrome, and a syndrome is a group of behaviors and beliefs that tend to come together. You tend to find them together. Codependence is probably the most well-known syndrome, right? So this kind of like salt and pepper or red hair and freckles. These are things that when you see one of these things, you tend to see them all. But I actually wanted them to make things that would be claimable by people, because many people with perfectionism will say, "Oh, I'm not a perfectionist. I never do anything right." Hi, Carrie. Good morning from Central California. Hello. That's my son is living in California, so it's nice to see you, Carrie. Let me know if you have any questions. I'd be more than happy to answer. So I was trying to make these things that someone would go, "Oh, I'm not a perfectionist," but then they would hear or read the syndrome, these traits, and they go, "Oh, well, maybe, yeah, I do that. Well, of course I do that. That's one of my strengths. Well, yeah, that I do that all the time." And yet they might be able to begin to see it as something that was problematic or even destructive. Here they are. The first one won't surprise you. If you experience perfectly hidden depression, you likely are highly perfectionistic and have a constant critical and shaming inner voice. We talked about that with destructive perfectionism. You demonstrate a heightened or excessive sense of responsibility. And what I mean by that is that even though your plate is full, you take on other things. There was a woman named Laura I was working with, and she had decided she really wanted to work on this. And she went to like a committee meeting or some kind. And she literally sat on her hands, and she got out to her car. But when they were asking, she sat on her hands when they were asking for people to say, "Would you take this on? Would you take this on?" And she didn't do it. She got out of the car and she said, "At first I was so proud of myself. And I thought, I can't wait to tell, Dr. Rutherford or Margaret," whatever she called me. And then she felt incredibly guilty. Here's that shameful inner voice. It would say things like, "Everyone in that meeting is just as busy as I am. How could I not have taken something on?" And she had to stop herself from walking back into the meeting where they were cleaning up and saying, "You know what? I'll do that." And she was crying when she told me that. She said, "The sense of guilt of me not taking any responsibility was incredibly difficult for me to feel." So you can see how deeply entrenched that is. Okay. One meeting, and that's the way she felt. You detach from painful emotions by staying in your head and actively shutting those emotions off. These people love to think. They're thinkers. They love to be analyzers. If you struggle with this, you want to stay in your head. In fact, you'll even say things like, "Oh, I'm just very rational. And gosh, if I started crying, I'd never stop. And this doesn't make any sense to me. Why would I want to do that?" But what happens is it's because you are shutting them off, using that compartmentalization that we talked about. Hello there from Cape Town. It's nice to see you, Gotiha. I'm probably not saying your name right, but I'm trying. Number 4 is worry and need to control yourself and your environment. These people don't want to be seen as worriers because, again, that would be a little chink in that camouflage, in that armor, right? But they do worry a lot. And so, what they do with the worry is they control things. If I do it because of my perfectionism, I know I'll do it well. I don't trust anybody else to do it. And I'm trying to hide my worry. So I will just take control. But this turns out to be a cycle because then they get fatigued and resentful about the fact that they're the only one in their family taking care of their parents in the assisted living place or whatever. They're the one who's always carpooling kids and no one shares or something because she knows or he knows I'll get them there on time. And so, whatever the task is, it's done so repetitively, and then there's resentment and fatigue, but which you've got to hide because if you identified with perfectly hidden depression, you don't let anybody know you see, that you have vulnerabilities or that you're not anything but happy. And so then you worry that people are seeing that. You hear the cycle. Okay. Number 5, you intensely focus on tasks using accomplishment to feel valuable. I think we've already covered that. This is a different one. You focus on the well-being of others, but don't allow them into your inner world. Basically, these are people who are really wonderful, sincerely wonderful friends. They're the first person, if you've had a death in your family, not just to say, let me bring you some food, but they'll say, let me take your kids for the day. And you just be who you need to be. So I think that is but they don't let anyone else because they can't share their vulnerabilities. They have all these secrets they're keeping. And it is, and again, they can't, that camouflage, what I like to say, it becomes concrete. It becomes heavier and heavier and heavier to wear. Carrie, I'm so glad y'all are asking questions. Again, I'm Dr. Margaret. I'm glad y'all are here. I continue to isolate and have become unsociable. I went from being a perfectionist to not wanting to do anything. I never feel good enough. I've let myself go physically. Don't want to get myself ready, do my hair. The list goes on with my depression. If you can help, I would appreciate it. Well, Carrie, basically what I would say to you is that, you keep up being a perfectionist long enough, and it is very lonely and isolating in and of itself. And you can develop actually classic depression, which sounds like you have, where you don't have any interest in doing the things that you have done before, because all that stowing away, all that compartmentalization has begun to. I had someone write to me the other day, and she said, it's like my closet where I've stowed all those things is bursting open, and I can't ignore it anymore. And I feel terrible because just think of all those things that are stuck away, and they have incredible potency, emotional potency for you, or they wouldn't be stuffed away in the first place. And so then here they come, they can kind of seep into your world. Basically, I think you could educate yourself some about, read my book if you want to. It's available, whatever, wherever, but so you can get a handle on why you've done what you've done. But also, you may need to seek professional help. Always, always. Kylie, I've been depressed for many years. Everything seems like a constant cycle. There's no motivation left or try out any new things. Is there any way to turn it around? Is there one way to find inspiration to hope for better things? Well, Kylie, again, this is a comment about actual classic depression, and perfectly hidden depression is very different from that, but classic depression can be devastating. There's actually, there's some newer treatments. I don't know if you have been in treatment yourself, but if you haven't, you could certainly try out more traditional methods of therapy and with a therapist or through talk therapy. But there are some wonderful, if it's trauma-based, there are some wonderful new techniques. There's somewhat new EMDR, eye movement desensitization and reprocessing therapy is one of them that is wonderful for trauma, and you would look for an EMDR certified therapist. There is neurofeedback, There is something called transcranial magnetic stimulation that I've now had 4 or 5 patients do. It is covered by insurance, and it's actually a for deeply ingrained depression, even chronic suicidal thinking, it's been shown to be very effective. I heard another article or another report about it just yesterday somewhere, and it's transcranial. It's called TMS. Just look it up. So, you're going to have to dig down and find some motivation. You're going to have to make yourself do something, but there are very, very hopeful things on the horizon, both through different therapeutic techniques, and then through these ancillary techniques that my patients are loving it. Let me finish with this list. Love the questions. Okay, so they focus on the well-being of others. They discount personal hurt or sorrow and struggle with self-compassion. These are not people who, even if they said to you, yes, I had a pretty painful childhood, would they be able to really feel compassion toward that child that they were? I had a man that I was treating for this as well as other things, but he he said to me that he had pulled out pictures of himself, which I often have people do, when he was around 6. And rather than having compassion for himself, because he had a very rigid, non-emotional family, he always had to do the right thing. He was Mr. High School, and he was still accomplishing as a man. And this is what he said to the 6-year-old. He said, "Don't grow up because all you're going to do is make mistakes." That is so sad. He could have no compassion for himself. He just had blame and criticism. Um, they believe strongly in counting your blessings as the foundation of well-being. Again, there's nothing wrong with counting your blessings and being grateful. But when that's all you can do, which we've already talked about, then that's a problem. They may enjoy success within a professional structure, that's unless procrastination is a part of their perfectionism, but they don't know how to do emotional intimacy. They are typically going to find relationships where someone wants an overfunctioner, someone wants someone to take all the responsibility, may be attracted to someone with narcissism. If they're lucky, they'll be attracted to someone who really does want to love them well and will finally tell them after 6 or 10 or 12 years of partnership, I don't know you any better than I did when we were dating. So there can be that as well. Let me take a couple of questions. Nelubega, I've been unacceptable because of being open to friend practical. I'm not real sure what that means, but sometimes, Nalubega, um, you have to learn to trust people, or they have to earn your trust before you share too much of your trauma with them, because they don't feel ready for that. So I don't know if you're picking people that you just immediately trust without them having earned your trust, or what that could be about. But if you're too open with friends before the friendship is really well established, you also may have just attracted friends who aren't very good givers. And I did that for a while in my own life. I was doing all the giving and they weren't. So that could be a problem too. Thanks for the question. And you're welcome, Kylie. Can perfectly hidden depression be classified as trying to deal with it yourself and not hidden, like recognition and solution? Classified as trying to deal with it yourself. I'm not sure I understand the question, Natasha. But if it's perfectly hidden depression or trauma-based perfectionism, a very strong part of it is, yes, maybe I see what you mean. Yes, you're trying to deal with things yourself. Sorry, a light bulb just went on. You are trying to deal with it yourself. You're told, therapy is for whiners. You don't complain, and so you do try to deal with it yourself. The difference is, I think, and maybe you don't know you're hiding it, but because that has been the way you were taught to be. And again, I'm not saying there's anything wrong with being strong or courageous or or going on when the going's tough. I mean, a lot of people have very, very tough lives, and they find a way to not, to just trudge forward. That is a lot to be desired, or a lot to be admired. But there are also a lot of people who would never admit to feeling any kind of struggle within themselves. No, I'm fine. I'm fine. No, I'm fine. I got this. No, I will talk to you about it if it ever really bothers me. And they won't. Okay. So they're keeping so much inside that, again, they can be so lonely. In fact, I will share with y'all, I had over 60 volunteers. I had been writing about this before I wrote the book. I've been writing blog posts. Um, and uh, I asked for volunteers, and I ended getting about 80 or 90 in about a 3-month period of time. And then I had interviews with all of them, and I asked them, why did you come forward and talk with some therapist that you've never heard of um, about something very painful for you? And they, to a T, said, because I don't want anyone else to feel as lonely as I have. It is a terrible life. The loneliness is excruciating. So, okay, let me finish. Let me see. Okay. All right. Well, Nalubega, I'm glad it was helpful. See, where I react by turning on high volume musicals. I fear of losing my hearing. Well, I'm not a medical doctor. So, but you're right. I think you're trying to hide from maybe some feelings you don't want to feel. So do that safely. And if you need to do that with more of a trusted friend, Nalubega, then you need to do that. Or it would be helpful to do that. Now, the 10th thing is you may actually have an accompanying mental health issue like obsessive compulsive disorder, or like an eating disorder, anything that's about high control, and anxiety disorder. So, you want to think about those 10 traits. And again, there's a questionnaire on my website at drmargaretrutherford.com. If you just put in questionnaire in the search, then it will lead you to that questionnaire. So I think we've already really talked mostly about how it's different from classic depression, because it's not going to no one is going to be coming up to you and saying, gosh, what's wrong? In fact, people are going to be coming up to you saying, you have a wonderful life. And, I wish I were more like you. And then 3 weeks later, you've killed yourself. I also want to tell you just one more story. A young woman sent me a voicemail, and in it she said, I did kind of reluctantly get into therapy, and then a year ago, because I was listening to your blog posts or podcasts, and then I got into therapy myself, and a year ago I started reading your book, and it fit me to a T. And I tried to tell my friends, and they said, "You're not depressed. You're the happiest person I know." And that hurt. And she even risked telling her therapist. And her therapist looked at her and said, "You don't fit criteria for depression." She was heartbroken and reached out to me and said, "What do I do?" And I said, "You find yourself another therapist. Maybe you try to rectify this with her first, but you've really got to have someone listen to you who's not pulling out." That my point in making this, the point of me bringing this up basically is because we in the mental health profession are missing this, and people are dying who we saw and diagnosed with anxiety or something, and didn't take the time to understand that maybe there's another presentation of depression that doesn't look like melancholy or anger or agitation. It looks like the perfect seeming life. So we're almost out of time. Carrie, you're welcome. Trying to care for my inner child because of childhood trauma, and as an adult, domestic violence growing up and in my past relationships. I'm a rape survivor, and I struggle with PTSD. I'm now 68 years old and still finding myself in the dark hole of despair. Well, Carrie, I will tell you that I'm actually 67, so you and I are almost the same age, and it's never too late. it is absolutely never too late. If you have really, uh, you might want to try the TMS as well, as something that would help you, or just talk to a therapist or your local provider about that. Tamalango, I have PhD, and I think now I've been attracting partners with narcissism. How do I undo the pattern? Well, listen again. If you've just come on, listen again. You have to become conscious of that this kind of perfectionism is a problem. You have to have a high commitment to changing it, because again, perfectionism is often the way you have survived and the way you have thrived, or thought you have thrived. So really confronting it, you've got to look at the rules you're living by and see which ones actually no longer apply or no longer helpful, but which ones you're still sort of following because you must do it, always have to do it, should always do it, that kind of thing, those absolutes. You have to go back and learn to have compassion for yourself as a child, and think about the things that happen to you, both good and bad, and begin to realize the effect and acknowledge, not blame, but acknowledge those things as things that were hurtful and that need to be worked through. And then the last one is actual to risk change, to not try to be so perfect, to let other people in on who you really are and what you really struggle with. And that can be a huge change. I have often said that the antidote, or the medicine for perfectly hidden depression, is self-acceptance. And that means knowing that the things that you are very proud of, and the things that you are not so proud of, the things that you maybe even have shame about in your life, neither one of those things define you more than the other one does. So know that. Carrie, thank you. In future podcasts, my podcast is the Self-Work Podcast. And I will tell you, we've had, we are closing in on 3.5 million downloads. We've got about 130 to 40,000 people now in 2022 downloading the episodes every month. So anyway, I don't know about transcripts of this video, but thank you. You can read a lot of my things at drmargaretrutherford.com, or my podcast is there. But I'm going to have to get off. Thanks so much for your questions. Sherry, please take care of yourself. You got to dig down and try and reach out. Nishant, you're so welcome. So have a wonderful day. And if you want to reach out to me, my email is askdrmargaret@drmargaretrutherford.com. Again, my website is drmargaretrutherford.com, very creative. And my podcast is called the Self-Work Podcast. And you can find it anywhere. Take very good care. Thanks so much. Y'all take care. Very good care.